Welcome. Thanks for joining us for our pelvic floor class, Your Pelvic Floor, Keeping It Healthy. My name is Stephanie Bloom, and I'm one of the physical therapists here at Restore Motion. And basically, we developed this class because we felt like there was a real need to give women more information about caring for your pelvic floor before things become real problematic. That a lot of the problems that women have with their pelvic floor tend to develop over many years, and oftentimes people are dealing with them at a low level. And sometimes they're using strategies that actually kind of make the problem worse in the long run. So one of the things we're going to do today is we're going to talk about some of the common problems with the pelvic floor, some of the key habits that you want to avoid or that you want to do in order to try and minimize those issues. And then we're also going to talk about some very basic exercises for the pelvic floor. So what is the pelvic floor? Okay, basically our pelvic floor is kind of a hammock-shaped complex of muscles and fascia that basically acts as a sling that helps to support our organs in the pelvis. So the pelvic floor muscles, okay, are attached in the bony pelvis. And if you look at these pictures, it's the male on your left, the female on the right, and they're very similar, but just have some slight variations. But in both males and females, the pelvic floor attaches in the front to that inside of the pubic bone, and then attaches to the back at the coccyx or the tailbone. Now, in the pelvic floor muscles, it's basically a complex of many different muscles, okay? Some are a little deeper, some are a little more superficial. You may hear names like levator ani, coccygeus, okay? Those are all part of the deeper layers of the pelvic floor muscles. You really don't need to worry too much about the different names, but just realize that they all need to work together in order to function properly. The other thing that's really important to understand about your pelvic floor muscles is that your pelvic floor muscles are just like any other muscle in the body. So they're just like your biceps, they're just like your quadriceps, in the fact that they need good strength, good flexibility, and endurance in order to function well, okay? Our pelvic floor muscles have to be able to both contract to support all the organs and to help us stay continent, but we also need to be able to relax those muscles in order to actually void. Now, the pelvic floor muscles are kind of arranged in two triangles, and this is true for both males and females, okay? There's the urogenital triangle, which in the picture is the green triangle. And it is the area, the muscles that are surrounding the urethra and then the vagina in women. And then kind of behind that, the purple triangle is what we call the anal triangle of the pelvic floor muscles, okay? And that really is surrounding the anus. And so all of those muscles, both the muscles in the more front part of the pelvic floor and the muscles in the back part of the pelvic floor, once again, have to be able to work together in order for the pelvic floor to function properly. Now, our pelvic floor, one of its primary roles is to help support the organs. But one of the things I do want you to realize is that overall kind of fitness level is not necessarily a good indicator of pelvic floor strength. Okay, even elite athletes can have difficulty with their pelvic floor function. A lot of it has to do with the balance of the muscles in our core trunk. So for example, if the abdominals are much stronger than the pelvic floor muscles, you're going to get a lot of downward pressure on the pelvic floor muscles. Those pelvic floor muscles aren't going to be able to support as well as they should. So our pelvic floor, and we're going to talk about this more in just a minute, is a part of our core, and it's a very important part of our core and an important piece of our overall muscle balance in this region. So when we talk about the pelvic floor functions, a lot of times they describe them as kind of the 5 S's. Our pelvic floor is really a pretty, plays a lot of different roles in our body. And it's pretty amazing, actually. So obviously one of the key ones is support. So our pelvic floor acts like a hammock or a sling, kind of going from the front of the pelvis to the back of the pelvis. And it helps to keep all those organs, especially the bladder, the uterus in women, and the rectum, kind of in place. Okay. Our pelvic floor muscles always have some tension. They're always turned on to some degree. Okay. They are constantly having to work. Even if I'm just sitting here and I shift my weight a little to the left, the pelvic floor muscles are going to react to that. Okay. But our pelvic floor muscles have to be able to increase their level of contraction whenever there's an increase in abdominal pressure downwards, such as during a cough, or when we laugh or sneeze, or if we lift something heavy. So our pelvic floor muscles are constantly at like a low level of tension, but then they have to be able, from that baseline, be able to contract more in order to provide the support that we need during different activities. And then they need to be able to relax in order for us to have a bowel movement or go to the bathroom. And that ties in with one of the other key functions of our pelvic floor, which is to help us be continent. Our pelvic floor, embedded in our pelvic floor, are what we call the sphincter muscles. And there's the urethral sphincter and the anal sphincters, and they help to prevent that the urine and the feces from leaving the body when we don't want them to, when we are not ready yet to go to the bathroom. It's not going to be the focus of this class, but I do want to mention that our pelvic floor muscles are also involved in our sexual function. Okay, when the pelvic floor muscles are strong and working well, it's easier to achieve arousal, and it's easier to achieve orgasm. Okay, when the pelvic floor muscles are working well, there's better lubrication. And so there is definitely a relationship between pelvic floor dysfunction and sexual dysfunction. And if you're having any issues in that regards, like I said, that's beyond the scope of what this class is going to talk about. But I would encourage you to see and talk to your physician or a pelvic floor physical therapist so that you can look into it further. And then this is a little bit what I was talking about before, but that the pelvic floor is actually a key part of our postural stability. So when we think about the core muscles, okay, we've got the abdominals in the front of the body. We have the diaphragm kind of across the top. We've got the back muscles, especially the multifidus along the side of the spine. And then we have the pelvic floor kind of at the bottom of what we call the canister. So all of those muscles have to be able to work together, and they have to be able to work together under different pressures in order for us to have good balance, good stability, and to help us prevent injuries from happening. So for example, if the abdominals are stronger than the pelvic floor, and you're constantly doing a whole bunch of abdominal exercises, that's going to be pushing down on the pelvic floor if the pelvic floor can't resist that level of abdominal contraction. And that can potentially make a prolapse worse, or can potentially contribute to symptoms of incontinence. So a lot of what we're talking about is muscle balance and trying to get the muscles of these key core trunk muscles working better together. And then the last function that I want to talk about, because it actually really is a crucial one for our overall health, is that our pelvic floor kind of acts like a sump pump in our pelvis. The contractions in our pelvic floor help to move some of the fluid and the blood back up out of the pelvis and back into our circulatory system. And so when the pelvic floor isn't working well, you can get more congestion and kind of fluid building up in the pelvis, which can exacerbate any kind of pain issues. And also just create more pressure that then those weak muscles have to work against. So we don't often think about it, but our pelvic floor is a very dynamic part of our whole system. So, often whether it's because of embarrassment or just a lack of awareness, but people often experience pelvic floor symptoms for an average of 7 to 8 years before they typically seek help, either from their doctor or from a physical therapist. What's interesting in that even in studies of college students, of female college students who had never had a baby, 25% of the women reported symptoms of stress incontinence. So they were already having some issues with their pelvic floor. And other studies have shown that at some point in their life, 50% of women will suffer from issues with incontinence. So I want you to understand that it's common, but it is not a normal part of aging. Okay, the basic bottom line is that there is a muscle imbalance issue that we want to try and address. So yes, pelvic floor issues are very common in our kind of Western civilization. And certainly they're more common as we get older, as changes in hormone and muscular changes kind of exacerbate the problems. But that original cause is really that muscle imbalance around the pelvis. And that's the key place that we want to start to address. And pelvic floor issues are not just a female issue. Many males, the statistics and the research say about 30% of men under 50 and about 50% of men over 50 will have some issues with their prostate and their urinary function. So there is pelvic floor physical therapy both for men and for women to address these issues. So this is a graph that you probably saw in your high school biology class many, many years ago. But basically, it's a really key concept that I want you to understand, is that our pelvic floor muscles, like I said, are just like any other muscle in the body. So they're just like the quadriceps or the biceps, okay? They have a ideal length at which they function best. Okay, so when they're more at that ideal length, they can generate more power. So in this graph, okay, the length of the muscle is kind of the bottom axis, and the horizontal axis, and then the vertical axis is more the amount of power that those muscles can develop. And so you can see it's a little bit of an arc, and that the muscle can generate the most power in that middle part of their length. What that means is that if the muscle is really tight, or if the muscle is really overstretched, it's going to have more difficulty generating a lot of power in order to contract and to function well. So a lot of people associate pelvic floor weakness with laxity. And that does occasionally exist, but I will tell you the far more common issue that we see is that people have tight and weak pelvic floors. So meaning there's a lot of tension in the pelvic floor. Okay, the pelvic floor is kind of in that more shortened or what we call hypertonic state. And then because of that, the pelvic floor can't contract as well. So that pelvic floor, because it's in that shortened state, is weak. And this has an implication in terms of what you want to do exercise wise for the pelvic floor. So so in addition to strengthening the pelvic floor, oftentimes we want to start to elongate and stretch and lengthen those fibers of the pelvic floor so that we can then actually get a better contraction of the pelvic floor to get more strengthening of the pelvic floor. So there's a lot of kind of misconceptions about the whole idea of Kegels, okay? So Dr. Kegel was a surgeon who developed the first biofeedback device for pelvic floor training. And he actually found that 80% of the women who were referred to him for surgery could resolve their issues with exercise when they were able to do it correctly. So a Kegel contraction is basically just a contraction of the pelvic floor muscles, okay? Many people, including many physicians, think that Kegels don't work. Often it's because people aren't doing them correctly. They try for a few weeks and they don't see any changes. So then they get frustrated, they stop, and then they kind of get in this cycle where they're continually getting weaker and weaker in their pelvic floor. So this is where if you have a pelvic floor that is too tight and weak, okay, understanding that, which like I said, is by far the more common pattern, kind of affects how we want to exercise it. Because sometimes just doing Kegels alone is oftentimes not enough. Now, you may also see online the idea that you can practice Kegels by stopping the flow of urine midstream. And while that's okay to do as a test to see if you're doing the Kegel correctly, I would not advise you to do it as an exercise on a regular basis. And the reason is that it interrupts the normal kind of physiologic response that should be happening when we are urinating. So when we're urinating, our pelvic floor muscles should be relaxed. They should be relaxed so that we can actually void and let the urine out. Okay, and so if you're constantly trying to do the Kegel in the middle of that stream, that kind of disrupts the normal function of the pelvic floor. But like I said, if you're not sure if you're doing the Kegels correctly, then it is a good way just to test it. Or maybe you do it once a month just to see if as you're exercising, whether or not you're getting stronger and can better stop the stream. But please do not do it as a regular form of exercise for the pelvic floor. And you will see it list online. So I want to make sure that everybody understands that. Now, one of the other myths is that you should be doing a certain number of Kegels every day. Certainly, our pelvic floor is a key part of our core trunk stability, and we need to be incorporating our pelvic floor in our overall exercise program that addresses all of our core trunk. And so in a good kind of general exercise program, your pelvic floor should be working well with all those core trunk muscles with whatever exercise you're doing. And if you tend to have a weak pelvic floor, then yes, you probably want to do some exercises that are specific for the pelvic floor on a regular basis in order to help keep that muscle balance. Now, one of the other kind of myths is that pelvic floor physical therapy is just about doing Kegels. When pelvic floor physical therapy, we really want to look at the whole body, at the whole posture, the spine, the hips, even down to the feet, and figure out what is making it difficult for those pelvic floor muscles to contract to support. Okay, sometimes there may be a back issue or a hip issue or an SI joint issue or some issues at the pubes, that pubic bone, that are making it difficult for that pelvic floor muscle to contract. And that's just like any other muscle. For example, if you have a real irritation in your biceps muscle, it's very hard to use that muscle to really get a good, strong contraction. Now, when we talk about incontinence, and this is obviously one of the key common dysfunctions that we worry about, particularly for women, the individuals with what we call stress incontinence, okay, they typically lose urine when they sneeze, cough, laugh, pick up something heavy, maybe when they exercise or jump, okay? Basically, any movement that increases that downward pressure on the pelvic floor above what those muscles can generate to keep the urethra closed. Okay, so it is a pretty much a question of the forces downward versus the forces upward. So when we talk about stress incontinence, it is very much of a muscle balance issue, and we really want to make sure that we are able to strengthen that pelvic floor to improve that stress incontinence. Now, what tends to happen is most people they often start to have a few symptoms of stress incontinence. Maybe they're leaking a little bit when they're coughing or laughing, and they start to compensate for that. And they start to compensate maybe by decreasing their fluid intake, whether consciously or subconsciously. They may say, oh, I don't want to drink anything right now. I'm getting ready to go get in the car and go get on the Capitol Beltway. Or I don't want to drink anything right before that long meeting. And so they start to decrease their fluid intake a little bit, okay, because they want to minimize that chance of the incontinence happening at an inopportune time. But what happens then is that the urine actually becomes more concentrated. And when the urine is more concentrated, it's more irritating to the bladder lining. So then the bladder starts to become irritated and become sensitized. And then they start to have issues with incontinence also when they get the urge to go to the bathroom. And that's what we call the urge incontinence. So that occurs when they can't quite make it to the bathroom in time. When you get that urge and you leak at that time. And oftentimes people have symptoms of both stress and urge incontinence, and that's what we call the mixed incontinence. And basically, that issue of how do you manage these symptoms, okay, can play a role in whether or not those symptoms continue to get worse and worse over time. So we talked about oftentimes people decrease their fluid intake. The other thing that oftentimes people start going to the bathroom more frequently. So normal is considered about once every 3 to 4 hours. They start going every hour or two. And then what happens is the bladder gets used to going to the bathroom that frequently, and then it doesn't get fully kind of stretched out to its more maximum volume. And so it starts to become, once again, sensitive. And so then it starts to give you the urge to go, even though it's only a third of the way full or half full. And this all contributes to issues with what we call urinary frequency, having to go to the bathroom more frequently. which can become very debilitating because a lot of times people will start to cut back on their social activities because they don't want to go out or don't want to be somewhere too far from a bathroom. So these types of incontinence, okay, and there is also fecal incontinence, although it's not as common, but it is certainly an issue that pelvic floor physical therapy can also help to address. Now, with the urinary incontinence, that whole fluid balance is a real important issue. And everybody always asks, well, then what is the right amount to drink? And I'll be honest with you, there is no generally accepted answer to this. If you look at most of the different recommendations, they all come back to somewhere in the neighborhood of 6 to 8 glasses of water a day, whether they calculate it based on weight or other factors. By far, probably the better way to monitor it is to look at the color of your urine. If your urine is a dark yellow, yellow color, you're probably a little dehydrated and don't have enough fluid in your system. Your urine should just be a nice pale yellow color when our body has a good balance of fluids. And do realize that there are some substances such as coffee, tea, alcohol, which can actually irritate the bladder lining. And that can also lead to more of that urge incontinence and that more of that feeling like you need to go to the bathroom more frequently. Now, the other really common dysfunction for women is prolapse, okay? And there can be different types of prolapse. Uterine prolapse, there can be what they call a cystocele, which is the bladder prolapsing into the front wall of the vagina, or a rectal prolapse, which is also called a rectocele. That's the rectum is kind of basically pushing against the back wall of the vagina. When you're having, once again, these signs and symptoms of the prolapse often develop over many, many years. But some of the common signs can be a feeling of kind of a bulge in the vaginal area. There can be issues with urine retention. There can be incontinence. There can be pelvic pain. There can be issues with painful intercourse. Constipation can be a sign of some pelvic floor tension issues. Oftentimes women will have the feeling that the tampons are getting pushed out, okay, because of the prolapse, and also a lack of sexual sensation. But all of these signs and symptoms help to tell us that prolapse is becoming a significant dysfunction in the pelvic floor. Now, with the prolapse, when the prolapse is mild, it is very, very treatable with physical therapy and with improving the pelvic floor function, okay? When the prolapse becomes severe enough, then the recommended treatment is really surgery. And prolapse is by far one of the more common rationales in the United States for hysterectomies. So it's something that the sooner we address it, the better off women are going to be as we all get older. Now, I want to talk just a little bit about one other key issue, and that's pelvic pain. So we talked about incontinence, prolapse, pelvic pain. Pelvic pain can be extremely debilitating. It can limit somebody's ability to sit. Obviously, it can limit intercourse, but it can limit just their ability to really function on a daily basis. And a lot of people don't realize that there is a lot that physical therapy can do. Oftentimes there are a lot of issues with some of the surrounding joints and area, the spine, the hip, the SI joints, and addressing all those areas with both manual therapy and exercise, in addition to treating the pelvic floor itself, can often help to improve pelvic pain. Now, the exercises that we're going to do today, the first one, the one that is going to incorporate the breathing, is appropriate if you're having a lot of pain. But one thing, if you have a lot of pelvic pain, that you do not want to do is do a lot of Kegels, because oftentimes the pelvic floor is very, very tight in the individuals who are having pain. And so if you're just doing a lot of Kegels, you may actually exacerbate the pain. And I would really encourage anybody who's having any significant pelvic pain issues to really see a pelvic floor physical therapist, whether it's here at Restore Motion or somewhere else, to really further investigate what's going on in their, more individually. Now, there are other types of common pelvic floor dysfunctions. Vulvodynia, prostatitis, constipation is often associated with pelvic floor dysfunction. Pelvic floor dysfunction can also affect your back, your hip. So all of these areas can be affected by the pelvic floor function. So that just gives you a little bit of information about the pelvic floor. And now what I want to move towards is a little bit more talking about some very basic exercises for the pelvic floor musculature. During this class, it's your choice. You can either choose to lay down and try the exercises, or you can watch. It's really your decision. So the first thing I want to talk about is what we call the diaphragmatic breathing. Okay. Remember when I was talking about our core trunk, I said our diaphragm is kind of the top of the core and our pelvic floor is the bottom. And we need that diaphragm and that pelvic floor to be working well together in order for our core trunk muscles to work together. One of the easiest ways to start to practice good diaphragmatic breathing is to lay down on your back, just like the picture here of the person. Put one hand on your stomach, one hand on your chest, okay? Take a deep breath in, and I want you to really feel the air come down mostly into the abdomen, or the pressure of the air come down into the abdomen. The hand at the chest should stay pretty still. Okay, if the hand at the chest is moving a lot, then what you're doing is you're using more of the what we call accessory breathing muscles. So more of some of the neck muscles to help you breathe, rather than getting that good deep diaphragmatic contraction. So in the long run, that creates a lot of tension and stress in the neck. So we really, and it also, then you don't get good air, the pressure of the air all the way down into the pelvis, to help give that pelvic floor kind of a natural little stretch all day long as you're breathing. So I want you to, either laying down or sitting up, however you're comfortable right now, go ahead and put one hand on your chest, one hand on your abdomen, and just think about taking a good deep breath in, really get the air down into the abdomen, and then just slowly exhale. And breath in again, good deep breath, get the pressure of the breath down into all the way down into the abdomen and the pelvis, and then slowly exhale. That slowly exhale is really important because it helps to calm down our sympathetic nervous system. And oftentimes our pelvic floor is tight when our sympathetic nervous system is really revved up. And so really focusing on that breathing helps to allow that pelvic floor to relax. Now, once you kind of get the hang of the the breathing just in that position, then you can start to incorporate the breathing into what we call the happy baby position. So the easy version is the one on the top of your screen where the gentleman has both knees up to his chest with his hands behind the thighs, and he's just pulling the knees kind of up and out towards his shoulders a little bit. And then holding in that position, once again, I want you to try and get that good deep breath all the way down into the pelvis and into the abdomen, and then nice, long, slow exhalation. Now, if you're very flexible, you can try the version that the lady, the bottom picture on your screen where she has a hold of her feet, or you can hold the ankles. And once again, focus on the breathing in that position. So these positions just help to open up that pelvic floor a little bit more. Because remember I said that pelvic floor weakness is often because the pelvic floor is tight and weak. And so we want to start to elongate those pelvic floor muscle fibers and lengthen them so that then we can better strengthen them when we work on the strengthening exercises. So this happy baby is a really useful and probably one of the most critical kind of first things that you want to start to do with any kind of pelvic floor issues. Now, you can also, if those positions are not comfortable for you, you can also try this in the child's pose position from yoga, where when you're on your hands and your knees, you bring your bottom back towards your feet and let your body relax down. Once again, this position helps to open up that pelvic floor, and then you can focus on the deep breathing to really try and lengthen those muscle fibers for a little bit. So that's that key lengthening of the pelvic floor muscles. Then a lot of people, and this is a more advanced version where you're actually doing a squat and then you're trying to do the breathing. So, but I would definitely start with the other ones, but this would be the more advanced version. Now, a lot of people, when they start to do Kegels, they can't feel if they're doing it correctly or not. They just don't have the sensory awareness to know whether or not they're doing the Kegel correctly, okay? And that's why there's what we call some role for control exercises. And these exercises were developed by a PT in Montana, Janice Hume. And basically what they do is use some of the hip muscles to help you get a better pelvic floor contraction. Oftentimes what I see in my practice is that by the time people have enough of an issue that they come in for physical therapy, they can barely get a flicker of a contraction in their pelvic floor. And so it's very hard to get a good strengthening effect. And this is why I think people get so frustrated trying to do Kegels on their own a lot of times, is if they're just getting a flicker, they're not really of a contraction, they're not really getting enough strengthening. And this is where using a ball and a band can often be helpful to get started. The idea is these are kind of pre-Kegel exercises. They help you get the pelvic floor going so that then eventually you can do more Kegel exercises. So in these exercises, you're sitting up nice and straight. And with the picture at the top there, you're going to put a ball between the knees, and then you're going to roll the legs in and squeeze the ball, okay, with your knees so that your heels are actually going out to the side. So with this, okay, it's not just a squeezing of the thighs together. You want it to really be a rotation of the legs in to squeeze the ball. What that does is that helps to automatically activate your pelvic floor. And I see it over and over with biofeedback in my practice, that people are able to get a more sustained, better contraction with this than they can often do when they're initially trying to do Kegels. So when you do these exercises, it's really important to make sure that you do not hold your breath. So what you want to do is you want to put the ball between your knees. Okay. And then you want to hold it. Okay. So you're going to roll the legs in, squeeze the legs so the heels are going out to the side. And you want to just count, hold 2, 3, 4, 5. And then you want to relax 2, 3, 4, 5. Then you'd roll the legs in again, squeeze the ball 2, 3, 4, 5. Then relax 2, 3, 4, 5. You really want to make sure that you relax for just as long as you squeeze. Because remember I said that pelvic floor needs to be able to both contract and relax in order to function well. And so part of doing this exercise is to really help and kind of get the pelvic floor more coordinated again. But it really is working on turning the pelvic floor muscle on, turning the pelvic floor muscle off, turning it on, turning it off. And so when you do this exercise, you want to make sure that you relax in between each contraction with the ball. You also want to make sure that you're sitting up straight and that you're not holding your breath at all. You should be able to breathe and count and talk while you do this exercise. So when you do this exercise, I usually recommend people start by doing it 10 times, okay, with the ball. And then the second part of what we call the roll for control exercise is with the band. And you can use, it has to be a kind of a strong, some sort of band, okay? And you can tie it around your thighs, just like there in the picture on the screen. And you want to have your legs close together as you tie it, so the band is pretty tight. Okay, and you can get bands if you're seeing a physical therapist, obviously, but you can also a lot of times buy them on the internet or at a sporting goods store. And then what you want to do is you want to roll the legs out and so that the heels come together. So it's kind of the opposite motion. So in this one, you're rolling the thighs out to the side, out, so that, and pushing the heels together, holding it for that count of 5, and then letting it relax for a count of 5, making sure you're breathing the whole time. So it would be like, ready, roll the legs out, heels together, 2, 3, 4, 5, and let it relax, 2, 3, 4, 5. And ready, roll the legs out, 2, 3, 4, 5, and ready, and let it relax, 2, 3, 4, 5. Ready, roll the legs out, heels together, pushing against each other, 2, 3, 4, 5, and then let it relax, 2, 3, 4, 5. When you do this exercise, you really kind of want to have 3 points of resistance, one on each side of the band at the thigh, and the heels pushing together, so that there's really that third point of resistance. That really helps to engage that pelvic floor, kind of activate it more automatically so that you can get a more sustained contraction of your pelvic floor, even if you can't do a Kegel correctly. So these roll for control exercises, like I said, are what we call pre-Kegel exercises. So they're really good to do when you can't tell if you're doing the Kegel correctly. They help you get the muscle to start the strengthening process. And I would generally start by doing 10 of the ball and 10 of the band in the morning, and 10 of the ball and 10 of the band in the evening. When the pelvic floor is really weak, we find that it works really well to do short practice sessions rather than doing a whole lot at one time, where that muscle fatigues out too quickly. Now, once you kind of get the pelvic floor going and you're doing, and you know you're doing the Kegel correctly, because you can either feel yourself lifting the pelvic floor up and in. You want to make sure that you're not pushing down or bearing down with the pelvic floor when you try and do a Kegel, because then you're just increasing that downward pressure. Now you can monitor or check yourself either by using your own finger in your vagina a little bit to make sure that the pelvic floor is contracting and lifting up, or you can do what we were talking about earlier, try and interrupt the flow of urine by trying to do a Kegel when you are going to the bathroom. Now, and if you're able to stop that flow of urine, then you're probably doing that Kegel correctly. Now, once you get that Kegel and you're able to do it correctly, you really want to practice that Kegel. And the easiest way to start practicing that Kegel is just laying on your back with your knees up. And you really want to focus on lifting that vagina and anus up, squeezing it and lifting it up towards the pubic bone, the front of the pelvis there. When you do Kegels, you want to practice both quick Kegels, trying to do it, turn the muscle on and off quickly, like contract, relax, relax. And you also want to practice what we call more endurance contractions, holding that Kegel for a count of 5, and then eventually holding it for a count of 10. And then you want to gradually progress to doing it in harder positions, such as sitting and standing, because that's obviously where we have to function most of the day. Now, if you're having trouble figuring out how to do the Kegel correctly, I would definitely recommend that you see a physical therapist to work on it more individually, because sometimes there can be some issues that are preventing you from doing that Kegel correctly. Maybe there's something going on at your hip or at your SI joint. And if we address that, then it's going to be a lot easier for you to strengthen. So these exercises are kind of a general guideline of things that you want to start to work on. Because as I've said, particularly with the incontinence and the prolapse, the sooner we start to address these issues, the better off you generally are in the long term. As that pelvic floor gets weaker and weaker, then there's more and more issues with the pelvic floor. So basically, in order to kind of summarize exercise-wise where I'd recommend you start, I'd recommend you start with kind of that pelvic floor stretch or lengthening of the fibers, either with the happy baby or the child's pose, doing the breathing, and then start to work on the strengthening with the roll for control with the ball and the band. Trying to do it 10 times, twice a day, and then gradually start to work on the Kegels once you can get a decent contraction. And then generally, I would suggest that you kind of finish by doing one of the happy baby with the breathing again at the end, just so you kind of, after all that strengthening work, kind of relax those muscles again. And if you're not seeing progress, if you're not seeing an improvement in any symptoms of any incontinence or prolapse, I really would recommend that you see an individual, that you have a more individual evaluation with a pelvic floor physical therapist to develop a more individual treatment plan. Because like I said, this is kind of very general pelvic floor information that we think is really helpful for a lot of women to know and to understand more.